guys, Dr. J here with another episode of Move With Me Monday, and today I want to address nerve flossing of the upper extremities, so basically the neck and arm area. When we think of flossing, we often think of our teeth. That's the main thing where we hear the word flossing in our day-to-day life. But flossing of the nerves is going to use very similar principles as flossing the teeth, in that for us to floss our teeth, we have to pull the floss at one end and loosen it at the other, then pull the floss at the other end and loosen it at the other. We cannot pull at both ends, otherwise we are not flossing. With the nerves of the upper extremity and lower extremity, we cannot pull at both ends, otherwise we are tensioning the nerves, and that is a way that we injure them. So with nerve flossing of the upper extremities, we're going to be basically looking at a couple of different motions involving the neck and the arm. So if we are trying to loosen things through the neck, if I'm going to the right side, loosening would look like bending to that side, and lengthening would look like bending to the left. In terms of the arm combination, loosening the nerves through the arm would be bringing the arm closer to the body, and lengthening would be bringing the arm away from the body. Now, what I want you to remember in terms of how often and how much you want to do this is that we want to start low with this exercise. It's really great to keep those nerves moving, but if we do too much too soon with this, we can actually cause a little bit of injury or inflammation. So start with something like 5 to 10 reps of each of these in one day. See how you feel from that, and if it's okay after about a week of doing that, you can increase your reps. So we're going to be doing 3 nerves of the upper extremity that go from the neck basically to the hand. Those are the ulnar, radial, and median nerves. So I'm going to be showing you 3 separate motions. I'm going to be showing you them all on the right side just to teach you what that looks like, but you are going to do them on both sides when you need to. So if you're ready, here we go. So starting with the median nerve. Median nerve will go from the neck all the way down to the hand. And the way that we are going to lengthen this through the arm is with the palm down and arm straightened in this position. So what a nerve flossing would look like for this, we're going to start at the neck, tensioning there, and then we're going to move to tensioning at the arm. So arm in, neck to the left side because we're lengthening through this way. The neck comes back, and the arm extends and palm goes out. Arm comes in, neck moves. Okay, so next we are going to do radial nerve flossing. So same thing, we're going to be doing the right side on this side, and the motion for the arm is going to look a little bit different than the median nerve. In order for us to maximally lengthen the radial nerve through the arm, we are tucking the thumb in, basically making a fist, and turning the arm in like so, bringing it into slack, bringing the arm up. And we're going to be using the neck again, moving it towards to loosen it and away to lengthen that nerve. So what that is going to look like, if we're starting with the neck, arm up, neck to the side, neck over, arm tucked and in. Arm up, neck to the side, neck over, arm down. Okay, so now we're going to address the ulnar nerve, which goes from the neck basically down to the inside of the hand to the 4th and 5th fingers. Now in order to slack this nerve, again, we bend the head to that side, and in order to lengthen the nerve, we're bending the head to the opposite side. And now in order to basically tension the nerve through the arm, we are tucking the 4th and 5th finger up. And then in order to take the tension off, we are tucking it in and down with the 4th and 5th finger. Lengthening through the arm, slackening through the arm. So what the motion will look like is, if we're trying to slacken it, we're going to start slack at this end and tensioning at this end, at the head. Then the head moves this way and the arm comes up. Arm moves down and in, neck to the side. One more time, neck here, arm up. And let it go and stretch at the neck. All right, so this has been another episode of Move With Me Monday. As always, if you have any comments, questions, or concerns regarding anything that's come up while you were trying these exercises, please do not hesitate to reach out to the clinic through email, Facebook message, or phone message, and we'd be happy to direct you accordingly. As always, stay safe, everyone.